Welcome to Leaders and Legends, a show about the very best doctors in regenerative, orthopedics, and sports medicine. I'm your host, Dr. Charles Mahl. My goal is to give you an in-depth look into the lives of the top experts in regenerative medicine, the doctors' doctors, who are globally recognized for their skill, compassionate care, and commitment to finding cures. These are the physicians who teach internationally and nationally, the ones I would trust with my own care, and the absolute best of the best. How did they get so good? What makes them tick? In each episode, I sit down one-on-one with these remarkable individuals to hear their unique stories. Whether you're looking for a few life lessons or you're a fellow physician hoping to pick up a clinical pearl or two, this show is for you. So sit back, relax, listen, watch, and enjoy. Thank you. I'm Dr. Mahl. Hello, welcome to Leaders and Legends in Regenerative Medicine. I'm your host, Dr. Charles Mahl, and this show is sponsored by the American Academy of Orthopedic Medicine. And today I'm delighted and happy to have as my guest one of the top docs in the United States, one of the leading researchers on prolotherapy and orthobiologics, Dr. Dean Reeves from Kansas City, Kansas. Dean, it's my pleasure to welcome you, and I thank you for being here. And I want to ask you some questions, but I want to start off at the beginning. Did you actually grow up in Kansas?
I was more than a few miles away from where I practiced.
So born and raised, medical
Missouri,
school?
across the state.
Oh, across this. All right, that's fair. That's good. Missouri. And you must love it there, right?
I like the Midwest,
You
yes.
like the Midwest. Wonderful, wonderful. Raised a family there?
Yes, 3 kids, 8 grandkids so far.
What made you want to become a doctor? What was the impetus for that?
A friend of mine just asked if I wanted to work in a nursing home when I was in high school, just out of the blue. I worked in a nursing home, and I loved working with the old people.
Terrific.
And I just thought maybe I'll do medicine, and it kind of stuck.
You went to medical school in Kansas also, right?
Yes, I went to University of Kansas.
And you did physical medicine and rehab there and just stayed on. So that's
Yes.
your real asset to the community, just staying in your own hometown like that.
I had a lot of connections there and good friends and groups I was with that I wanted to continue on with. So
That's
it was a
terrific.
pleasure to stay.
How did you get into prolotherapy? Because you were doing routine PMR, and we've heard this before on the show. People come in like orthopedic surgeries. They talk about steroid injections and then physical therapy, and then when that doesn't work, they go on to surgery. How did you find something a little bit outside our usual toolbox?
I was frustrated with all the methods. I was using the best ones we knew and had available. But I had a patient of mine call me that I had not gotten better. She wanted me to know about something because it had helped her. She gave me the name of a doctor to call in Tulsa, actually, named Dr. Merriman. Fine fellow. He learned prolotherapy 3 years before I did. I called Dr. Merriman, and it started out kind of strangely. I asked him what he did. He said, I inject people several hundred times with dextrose.
Several hundred times.
And I was about to hang up on him. And then I asked him out of curiosity, well, how do you learn this? And he said, well, why don't you go with us on a missions trip to Honduras? That was a strange thing for me to hear. And I thought, maybe I should be listening here.
Wow.
And so I also had a question of, well, but you only see them once a year, right? Don't you go back and they're only better for a month or so? Because that's what I was used to in medicine.
Sure.
And he says, well, no, we go back the next year and often they're still better in that area and they want us to treat something else. That's when I realized I need to learn this. So I had 3 small kids and I couldn't go to Honduras, which is where the missions experiences were at the time, where you learn for 2 weeks real intensively. Couldn't leave my wife with 3 small kids, but I spent 3 days with Dr. Gustav or Gus Hemwall.
In Chicago.
Yes. Saw him treat patient after patient that I could not have helped. He was getting them better, markedly better. So before I left, I had him treat my low back just so I would know what it was like. I'd had back pain because I was
We all have it.
I was trying to help my
Over and
patients,
sitting in the
straining,
wrong way.
couldn't even lay down flat in bed. The next day I was better, and one of our patients don't get better that quickly.
Exactly.
But I had a remarkable response, and I went home and I started doing it immediately based on copious notes I took. And even though I wasn't doing it real well, it still worked better than anything I had. And I've continued to learn since then.
But you went further than that, not only as a clinician learning a new technique to do to help your patients. You had the impetus to say, I want to know why this works. And you started doing research on it and comparing data, what would be a success, what would be a failure. So you kind of took it to the next level and taught me this stuff.
Well, you can say that, but that's not quite right. The reason why I researched is to prove that it works because it's not paid for by insurance. I felt an ethical compulsion to prove it because it was a non-paid for treatment. Second, I could already tell that doctors were being attacked that do alternative medicine. And I could see that that was going to happen more and more in the future. And I did it to protect myself selfishly from attacks, but also others, to help other doctors in the future, because I could see that if this is going to grow, we can't have it be stymied by frivolous attacks on doctors.
Exactly. I mean, it really does not cost a lot to do a prolotherapy treatment. Our typical solutions are something like dextrose, which is sugar water, and anesthetics like lidocaine or procaine. And when I first started learning about it through you, it was kind of like, to me, like this could cure or reduce pain in the third world because it's so effective and not really expensive, right?
Well, it's very interesting you say that, because I was just in India speaking about 3 weeks ago. And I was invited there because the doctor I had taught in Kuwait became a leader in prolotherapy in India. And when I went to speak there to their academy of my specialists, which is physical medicine and rehab, I could see they were very excited about dextrose because it's powerful and it's inexpensive. And so they're going to be great allies in research. And
I mean, just simple things like that have changed a lot of people's lives. And when I sit here and do these interviews and discussions, each one of us has a story like that we find it affected us and it made me better. And I've treated all these patients with other alternatives. And this really, really helps people. And it's simple yet elegant. So we all develop a passion for wanting to pass this on and help people. It's really a life-changing experience. And the prolotherapy leads us on to the platelet-rich plasma and whatnot. The things you do in your office, I know you train doctors in your practice besides traveling nationally and internationally to teach and pass on the knowledge that we have.
My overseas work is mostly by teaching on occasion because I'm in solo practice. You have to keep in mind that there's no funding for dextrose. It's not a drug. So I have to find doctors to work with me who are willing to treat patients for free. But I want to make one other point here. You know, yes, there's altruism involved, a great desire to have people have a treatment that's helpful for them. But I very frequently tell my wife, honey, I would have done this and learned all this just to treat my family. Because my family members had severe problems related to disability, and I had the blessing of being able to treat them and change their lives. My own family.
And that's the frustration that we have as doctors, that your own family was suffering with the care that the system gave us, the insurance model of medicine with steroid injections and physical therapy and whatnot. And over, we're saying inexpensive alternative wasn't part of the milieu to help us heal. And giving it to your family, like I give it to myself, and I taught my family to help me when I'm not healing well. So it's an interesting place. And now you travel the world teaching. That's what I do as one of my hobbies, and I love doing it. You know, if you ask me what my hobbies are, I'd say doing the medical missions, because taking time off from a private practice is hard to do. Who's paying the rent, right?
Well, and thankfully, I don't have to be out of the office much, because with the intercommunication available, I'm able to have, for the first time, teams to do research with 4 sites or more, and we can all stay in contact, and nobody has to have 100 patients. Each person can have just a certain amount. And for example, the studies I'm excited about now are the one on treating post-traumatic stress, which is so common. And just using dextrose with a very simple injection under this muscle And there are now 3 study publications that are nearing being finished.
So you don't have to do a stellate ganglion block per se. You go underneath the sternocleidomastoid muscle.
Well, you
Or
see,
which
there's
one?
very talented people that do stellate blocks, and that's a good treatment. But the nice thing about this is it uses no anesthetic. So you don't have an anesthetic risk. And all you have to do is get underneath that muscle. It's very simple.
With 5% dextrose?
Anybody can do it that knows ultrasound just a little bit. So it can make it available around the world and hopefully stop a lot of suicides in these poor people that have served our country.
You haven't published that yet, have you?
Writing it up.
Okay, good, because I'm going through the files in my head, and I've read a lot of Dean Reeves publications, and I'm waiting for that one now. So I'm waiting with anticipation for that. And what else are you doing now? You have another mission scheduled?
Well, there's been a new discovery, and it's very exciting. We found, and I did not, this is an internal medicine doctor. He found that you can treat stroke patients and others that are weak more than decades from stroke. And if you have a muscle that's weak, you can inject dextrose, simple dextrose, under the muscles that are weak, under the place where they insert, which a muscle starts
Origin and
finishes.
inserts. Yes.
And its insertion, if you inject dextrose under the skin, over the muscle insertion, within a minute to 2, that muscle becomes much stronger. So that's why I was in India in part.
Yeah.
Because I'm looking for people to study this method that I think in rehabilitation, we can change people's lives.
And this hasn't been
Years
done in
after this.
rehabilitation, to my knowledge.
It was just discovered, and we just published the first cases on it about 4 months ago.
This is very impressive.
So
I am just like you.
happy.
I am just like you. I've had some time off. You know, I was a retinal surgeon for 20 plus years and then retired. And then when Dr. Aldenstein gave me prolotherapy on my back, it was so cathartic that I put my finger in his chest and I said, Al, you're going to teach me this. And I spent 3 years with him in fellowship. And then he liked me enough to say, you're my partner now. And then I made him my partner, and we had a real bromance going. But he changed my life with prolotherapy after me not knowing this was out there for 30 years as a doctor. So, he was one of my mentors. Do you have mentors too, besides Dr. Merriman and the Hackett Hemwell Foundation?
It's interesting because the reason I do research is for a lot of reasons. But I also do it because every time I do a research project and get contacted, it's about something I need to learn too. And so right now, Dr. Hemwell initially, and a lot of the Hackett Hemwell and AAOM faculty have been wonderful. But I also am grateful for all the researchers that are studying new techniques that I get to learn because I'm working with them in research.
And you bring up the beauty of teaching, which is I like teaching because I like the beginning students who have the anticipation of learning what we know now, but they always ask me questions that make me reconsider what I'm doing or look at it in a different way. So I have to think, am I right or wrong now? So it keeps me on my toes, is really what I'm saying. It's a lot of fun. What kind of things would you have in mind to talk to a new young doctor about who comes in and he's all bright-eyed and bushy-tailed about wanting to learn from you? What are the things you see out of kids coming out of the residency?
Well, the privilege I have has been to have a med student or two in my office over a period of time because they don't know what they're going to do yet. But what they see is that every doctor, no matter their specialty, is going to have a high percentage of patients with pain. And the sources for pain are very, very common between these patients. And if they learn how to evaluate patients' pain sources and treat them, they're going to do prolotherapy and injection around nerves no matter what specialty they go into. So just a little exposure is enough to help them realize, for instance, that inflammation is what we treat with drugs, but that's not what causes pain mostly. What causes pain is nerves that are misbehaving. That's a type of different inflammation. Once they see that, then they'll have a powerful way to affect real inflammation like rheumatoid arthritis and then treat the other nerve-based sources of pain. So there'll be a more complete doctor who examines better and treats more effectively.
It's terrific. So we're making them exactly more effective as physicians and doing life-changing things with people who suffer from chronic pain. Dean, I want to thank you for being here. I hope you'll come back and we'll do this again and again. It's been my pleasure to have you this morning. And I want to say thank you, everybody, for watching the show. Tune in, come to Dr. Reeves' website. And if you have questions of other physicians, please don't hesitate to call his website or call the AAOM or call me, and I'll make sure Dr. Reeves gets it. Been a privilege to be here today. Thank you, folks.
What I'm about to say. Sunshine, she's here. You can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Yeah. Well, give me all you got and don't hold it back. Yeah. Well, I should probably warn you, I'll be just fine. Yeah. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if